Gosia and I'm a fourth-year kinesiology student at the University of Waterloo, working under Dr. Laura John Gregorio. Kinesiologists are involved in injury prevention and managing chronic diseases. They focus on disease prevention and overall well-being of an individual while promoting physical activity and optimizing movement.
We have Terri here with us today. Terri was recently told by her physician that she has a low bone density and osteoporosis, putting her at risk for fractures. Terri, however, has had no previous fragility fractures, and considering all clinical factors, she is at moderate risk for fractures. Terri has been completing resistance training for the past few weeks, with focus on building muscle strength, reducing falls, protecting the spine, and slowing the rate of bone loss. She is now ready to move on to more challenging exercises to improve her upper extremity strength. Ultimately, Terri hopes to challenge herself to become stronger to keep up with her active lifestyle.
Today we will be learning about the single arm row. This exercise has many variations and can be done at home using weights or resistance bands. The single arm row targets muscles of the upper back and arms. In Terri's case, the single arm row will help her improve her posture and strength. Regular strength training makes Terri feel strong and confident. Prior to having Terri exercise with weights, we will begin with demonstrating the proper technique for the single arm row. We will begin with a neutral spine and a bench for support.
Prior to beginning your exercise, we need to pick the appropriate weight. When picking up your weight from the rack, stand with your feet shoulder-width apart facing the rack. Slightly bend your knees and reach for the weight with both hands. When you pick up the weight, make sure your back is straight and your core is tight. When returning to your bench, step with your feet in the direction you want to go, avoiding twisting of the spine. Carry your weight in both hands close to your stomach. To place your exercise weight on the top of the bench, bend your knees and bend forward at the hips, maintaining a straight back. You may now begin your exercise. Place one knee on the bench while maintaining an upright posture and proper head alignment. Hinge at the hips and reach your hand forward to place it on the bench directly under your shoulders. Avoid pressing all of your weight onto the palm of your hand by spreading your fingers and shifting your weight forward. The shoulders and hips should create a straight line. Ensure that your leg on the floor is slightly bent at the knee. Pull your belly button in to stabilize the spine and ensure that there is no rounding or arching at the spine. Imagine someone wanting to place a cup of water on your back. A common mistake people tend to make is protracting their head forward to watch themselves in the mirror or looking forward. Ensure that your gaze is directly downwards, visualizing a straight line from the tip of your head to your bottom. This will avoid any strain to be placed on the upper back.
There are many levels of difficulty when performing this exercise. If any of the other variations appear to be challenging or unfeasible, return to the previous level until you are able to do so without any pain. Each level may also be modified to accommodate your individual needs, and all professional and clinical recommendations and opinions must be taken into consideration before exercising. Let's begin.
To accustom ourselves with the movement, complete one repetition of a single armed row with no weight on each side. Let's begin by maintaining a neutral spine and lifting your free arm while bending the elbow and lifting it towards the sky. The goal is to reach a 90-degree angle at the elbow and align the upper arm parallel to the ground. Keep your arm close to your body as you lift up until you can no longer pull your arm back while maintaining a neutral spine. Strive for a fluid and controlled movement. If you're comfortable with the movements as described and feel confident in increasing the difficulty, you may wish to add the weight you chose prior to beginning your exercise. We have chosen a 10-pound weight for Terri. Ensure you are selecting a comfortable weight that does not promote twisting in the trunk or loss of alignment at any point in the movement. Reach forward to grab your weight, maintaining your neutral spine. Keeping the cup of water on your back in mind, complete 8 to 12 repetitions on each arm. The last few repetitions should be challenging but not painful. Before going through the motion, activate your back muscles by squeezing your shoulder blades together and maintain this throughout the exercise. This will ensure that your shoulder doesn't dip down when you're holding the weight. The number and speed of repetitions comes secondary to the safe and correct completion of the exercise. Ensure you are engaging your core for a controlled movement, ending with your arms straight while avoiding a hanging feeling. Once again, ensuring an appropriate weight will avoid end-range shoulder movements in the downward arm position. This can prevent excessive strain on your shoulder. Terri is demonstrating proper form for the single arm row. An alternative to this activity is to place both feet flat on the floor with a slight bend in both knees and have one hand on the bench. If you do not have a bench, you can place your hand on a counter. Make sure to keep a straight spine and all other techniques in mind. Terri Terry's goal was to challenge herself to become stronger to keep up with her active lifestyle. The single arm row is great because it's fairly easy to perform. Similar to Terri, complete the single arm row 2 to 3 times per week and perform 1 to 2 sets. It is normal to feel fatigue and some muscle soreness after the exercise and in the following days. But if you feel sharp and localized pain to a muscle or joint which lingers, even following some period of rest, do not progress the exercise until this has passed. If you would like to progress this exercise, increase the amount of weight you're lifting and the number of repetitions. Unsure of how to progress? A great tool is a 2-for-2 rule. If you feel comfortable completing 2 more reps than initially prescribed for 2 consecutive workout days, you are ready to increase your weight and the number of repetitions. If you are concerned about doing this exercise properly, you should consult a kinesiologist or exercise physiologist before attempting this exercise.